Okay, we'll get started. Good afternoon, everyone, and welcome to today's TransFORUM, supporting the wellbeing of LGBTIQ plus people from culturally and linguistically diverse communities. My name is Nadia Garin, and I'm the Program Leader, Service Development, Planning and Evaluation at the Transcultural Mental Health Centre, and my pronouns are she, her. I'm stepping in for our Centre Manager, Maria Casaniti, today, who has had to take some unplanned leave, though she would have loved to have been here, as she recognises today's discussions contributing to the TMHC purpose, which is to promote and enhance the mental health and wellbeing of CALD communities through leadership and partnership. Before we begin, I acknowledge the Darug people as the traditional owners and ongoing custodians of the land where we are hosting this forum from today. I pay my respects to the Darug elders past and present and extend that respect to First Nations people that may be here with us. As we are online, I also want to acknowledge the many other traditional countries and language groups that everyone is meeting from as well. TMHC celebrates and embraces diversity. So from the world's oldest continuous culture of our first Australians to the cultures of our newest arrivals from across the world, we acknowledge people with lived experiences as migrants or refugees and their families and the courageous journeys of many generations of Australians who have made Australia what it is today. The TMHC also acknowledges the individual and collective contributions of those with varied lived and living experiences and those who love, have loved and care for them. We also acknowledge the lived experiences of LGBTIQ plus people and the significant impact that discrimination, stigma and exclusion can have on mental health and wellbeing. We recognise the importance of fostering inclusive, safe and affirming environments for all individuals, regardless of sexual orientation, gender identity or sex characteristics. We honour the resilience of LGBTIQ plus people and reaffirm our commitment to equity, respect and compassionate care. Finally, thank you and a warm welcome to all our participants today who come from many mental health and related social services across our wonderful state of New South Wales. Thank you also to our speakers Ting, Sekne, Bernard, Deborah and Lisa. This Saturday, 17 May, is the International Day Against LGBTIQ plus discrimination. May 17 marks the date in 1990 that homosexuality was removed from the World Health Organization classification of diseases. While we celebrate this milestone and other advancements in LGBTIQ plus equality, over 3 decades later, LGBTIQ plus communities still face discrimination. It is our hope that this forum contributes to championing inclusion by focusing on one part of the LGBTIQ plus community, those who also identify as being part of CALD communities too. As many of you are aware, New South Wales Health has 2 key strategic plans that prioritise this community. Firstly, the New South Wales LGBTIQ plus health strategy demonstrates the significant commitment of New South Wales Health to ensure LGBTIQ plus people in New South Wales receive high quality, safe, inclusive and responsive healthcare that delivers outcomes that matter to them. Specifically, it identifies impacting factors for people from CALD backgrounds, such as experiencing increased discrimination and mental distress based on cultural background, and being LGBTIQ+, including discrimination from within LGBTIQ+ and CALD communities. Cultural stigma and shame as a barrier to disclosing one's sexuality, gender, intersex variations to clinicians and challenges with service access, including language barriers, navigating a new health system, and the impact of migration pressures. There are additional compounding issues for LGBTIQ+ people of refugee and asylum seeker backgrounds in relation to experiences of torture, trauma, and discrimination. While the second key strategy, the New South Wales Plan for Healthy, Culturally and Linguistically Diverse Communities, identifies lesbian, gay, bisexual, trans, intersex or queer consumers as having particular vulnerability to poor health outcomes or poor access to health services, and that culture influences how healthcare is sought and how one might access services. For health professionals, we acknowledge that this webinar offers but an initial exploration of the lived experiences of LGBTIQ+ people from CALD backgrounds. This is especially important in the current context where LGBTIQ+ communities globally and within Australia continue to face discrimination, social exclusion, and systemic barriers, all of which can significantly impact mental health and well-being. We recognise that individuals at the intersection of cultural diversity and diverse sexualities or genders often experience unique and layered challenges. These personal experiences matter, and as practitioners, it is our responsibility to listen, respond with cultural humility, and provide inclusive, affirming care for the individual in front of us within the larger social context. Therefore, the aims of today's webinar through our presenters are to provide a snapshot of current research highlighting the intersection of issues that are faced by LGBTIQ+ individuals from CALD communities, and to build awareness of services and resources that can be utilised by health professionals to support this diverse community. This supports the ongoing building of clinical capacity of health professionals in our mainstream mental health services to assist individuals who might present to our services. It is contributing to the important dialogue in this space by deepening our understanding, promoting equity, and centering the voices and needs of those most affected. Our audience today is diverse, with many already using the mental health lens and the transcultural mental health lens, as is our work at the Transcultural Mental Health Centre. Today, we are hoping to bring to the fore the CALD LGBTIQ+ lens. So without further ado, let me introduce Emmeline, who is our mental health consultant and clinical psychologist at the Transcultural Mental Health Centre, who will facilitate today's session.
Thank you, Nadia, and good afternoon all. I use she, her pronouns. As an ally to the LGBTIQ+ colleagues, friends, family, and previous clients, patients, and consumers, I am honoured and excited to be able to facilitate this event for the Transcultural Mental Health Centre. Today is about our wider communities, our new migrants, our second-generation migrants, and those who identify as being part of the CALD community and maybe have their own term to describe their transcultural identity. Speaking of identity and language, terminology is important when working with LGBTIQ+ communities. We acknowledge that there can be a great diversity about around what terms are used. And today we use LGBTIQ+, which is consistent with the New South Wales Health Plan, but it is recognised that language and terminology to describe sexuality, gender, and intersex variations continues to evolve. And of course, my phone goes off at this time. I apologize. As health professionals, we should use the terms that our clients use to describe themselves, but also understand that these terms may not be appropriate for someone else. Today, we have speakers who will provide an overview of their recent research and resources. The speakers come from a breadth of perspectives, from research, clinical to lived experience, as well as showcasing some important resources. Their views and research provide a valuable foundation to this conversation. That said, it is important to keep in mind that what is shared doesn't necessarily represent the diverse voices within the LGBTIQ+ community. Our presenters may also speak about particular core populations, and it is important to consider that not all individuals within those communities will identify with those same experiences. And those from other cultures and within the LGBTIQ+ community may otherwise connect with those perspectives. So a few logistics. We're recording this session as a learning resource, and it will be available on our website alongside other relevant materials from the presentations. However, to ensure everyone feels safe and welcome to share their personal stories and aligning with the concepts we're going to discuss, we will carefully edit the recording to respect the privacy of individuals, presenters, and the stories shared. The core concepts discussed today will be shared, but personal experiences will remain within this space. Be aware that we will be discussing some difficult issues, so please be mindful of how this might impact you and take care of yourself. We've had some great questions come through registration, so thank you. And you may find that we will be, that they might be responded to through the presentations, but note that we are focused on our LGBTIQ plus CALD community, and so there are questions that may not be addressed today. We will provide broader resources after the webinar that may connect you with the information to address your questions and support you in your work. So let's get started. We will have each of our presenters present their research and resources over the next hour, and then have them come together at the end for Q&A. I'll briefly introduce each of them and their topic, and for their full bios, please head to the event page. So let me first introduce Ting Zhu. Ting is a PhD candidate at the School of Psychology, University of Sydney. Her research interests lie in cultural and gender psychology, with her PhD thesis, specifically examining minority identities, social support, and mental health among Chinese lesbian, gay, and bisexual migrants living in Australia. Ting is presenting on shifting identities across borders, experience of Chinese lesbian, gay, and bisexual migrants in Australia. This talk will explore how Chinese lesbian, gay, and bisexual migrants navigate identity shifts when crossing cultural and geographical borders to Australia. Drawing from recent research, the presentation will discuss that intersection of ethnic and sexual identities, highlighting the unique challenges and coping strategies employed by Chinese LGBT individuals in a transnational context. Thank you, Ting. When you're ready.
Thank you, Emily. Can you see my screen?
Yep, we can.
Thank you. Hi, everyone. Today, I'm gonna present Crossing Borders and Shifting Identities, Experiences of Chinese Lesbian, Gay, and Bisexual Migrants in Australia. First, let me start with a story. This is Ling. She's a lesbian living in China, where LGBTQ plus individuals face strong social stigma and same-sex marriage is still illegal. You know, in a recent survey, like 78% of people said that same-sex behavior is always wrong. Now, Ling just has experienced severe rejection from her family and friends. Some even call her disgusting. She fell into deep depression. Then Ling eventually decided to move to Australia, hoping for a more inclusive and accepting society. But, you know, one day she was racially harassed in the public. Someone said, "Go back to China." You know, the pain of being others just didn't disappear. It just changed form. So why I want to look into this question, because I want to improve the mental health of Chinese LGBT migrants in Australia, because they have experienced so many stigmatizing related to their sexuality as well as their ethnicity. You know, according to estimates, there are 20,000 Chinese LGBT migrants living in Australia. Again, understanding their experience is key to improving their well-being. You know, although the number seems like small, the findings can also reflect broader issues faced by LGBTQ plus migrants and people of color, especially those experiencing overlapping discrimination based on race and sexuality. So who we spoke to? I interviewed 19 people. There are 5 lesbian, 6 gay, 5 bisexual female, and 3 bisexual male. They have a median age of 30 years. They have a time in Australia. It's like a median of 3.8 years. 4 of them just fully out, 5 just partially out to family and friends, and 10 only out to friends. What we found? We found in their perspective, what's context in China. You know, people just described intense pressure from competition, traditional family values, and social expectations. For example, Sophia said, "I wish I hadn't been born in China because I think China is so competitive and living there is exhausting." Gay and bisexual men also felt like more pressure due to traditional family values. Jack said, my grandparents are getting older and feel like they must have grandchildren before they die. This just puts immense pressure on me, and sometimes they cry, like during the holidays, feeling like something is missing. Jack said it just makes him stressed out. They also perceive sexual prejudice in China. Cindy said, I think the biggest resistance likely comes from my family because my parents are traditional people and they probably think homosexuality is a mental illness. They also feel like other positive aspects of China, such as rich cultural heritage, convenience, and affordability. Regarding the context in China, in Australia, in Australia, things are more complex. It's more LGBTQ plus inclusive. For example, Monica said, compared to China, Australia is absolutely more inclusive. But other forms of exclusions or unfair treatment just emerge. People feel like racial prejudice and ambiguous microaggressions in Australia. Jack works in a retail company. He said one time a woman just yelled at him, said, where can I buy dog and cat meat? They also feel like cultural disconnect and status constraints in Australia. Sophia said, when I talk to people in Australia, the first challenge is that I don't understand what they're saying. They don't understand what I'm saying. Second, our culinary tastes are considerably different. They also experience some visa-related difficulties, like barriers to employment and long-term residency. Sophia also said, the problem is that when you're looking for a job, many employers requires permanent residency, which means locals, but I don't have them. They perceive other aspects of Australia like great social welfare, friendly people, but the life is very expensive, and they also have like safety concerns in Australia. Another thing we found is identity expansions depending on location. Regarding their LGBT identity, many people initially struggle with their LGBT identity, but later they just embraced it. Their LGBT identity is not a problem for most of them afterwards. Like Ryan said, I'm very accepting of it and really enjoy it. However, like gender matters. Gay and bisexual men continue to experience pressure to marry and have children, even after migration. But lesbian and bisexual women reported relatively greater autonomy. They don't have much pressure on it. For their Chinese identity, it becomes salient in Australia, especially in the face of racialization. Many just took pride in being Chinese despite new challenges. Hannah said, we have such an excellent cultural history. We have so many good things too. Having traveled to a variety of places, I find few cultures that can rival to Chinese culture. So to fully appreciate it, one will likely need to know Chinese. I'm grateful that I know Chinese, and I can read and learn several aspects of it. Also found what coping strategies and future expectations they have. They often use like selective outness. When they are in Australia, they are more open, but they're still hiding their sexual identity from family and on specific Chinese platforms like WeChat. They also have another coping strategy of avoidance. Even after coming out to their family, many just avoided discussing their sexuality again. to their parents or the other family members. They would like support from both professional and peer support. They seek like psychological counseling and seek support from Chinese LGBTQ plus friends. About their future vision, most people we interviewed wanted to stay in Australia, live authentically, and prioritize stability over traditional roles like marriage or parenthood. So what can we do based on these findings? I have four recommendations. First thing, we should address structural stresses related to migration, not just sexual orientation. Hopefully, we can just promote structural reform to reduce identity-related stress, like policy-level challenges to elevate uncertainty caused by the visa or job problems, including like more stable visa pathways, fairer employment protections, like greater access to public mental health services. Such reforms can reduce the chronic uncertainty and increase support. So another thing I think will be helpful is to develop culturally adapted mental health services. Psychologically, support should be delivered by professionals who are familiar with Chinese cultural values, such as family expectations, family roles, and social shame. So bilingual services or cultural competent interpreters in LGBTQ plus context are essential. Counseling should cover topics like intergenerational conflict, cultural adaptation, and accepting who they are in both family and social settings, not just coming out. The third point is to establish LGBTQ plus inclusive mutual support groups for Chinese migrants. Supports the creation of mutual group supports designed the Chinese-speaking migrants that explicitly welcome LGBTQ plus members, while also including heterosexual allies. Many people we interviewed just mentioned deep feelings of isolation as migrants. So these culturally safe, identity-affirming spaces can foster trust, emotional connection, and a sense of belonging. I think compared to formal services, such peer groups are often more approachable and less stigmatized. The last thing is to provide targeted support for gay and bisexual men. Many people we interviewed commonly reported like ongoing pressures from family to marry and have children, as I just said. This reflecting persistent traditional family expectations. It should not be assumed that migration equates to full liberation. Many still experience conflict between personal identity and family obligations. And so social support should acknowledge this tension and help individuals integrate their identities at their own pace rather than just pushing premature coming out. So this is a summary. Let me walk you through. In China, the LGBT identity is highly suppressed. Many people share their face strong stigma and rejection from family members. So their LGBT identity was important to them when they were in China. After migration, many hope to find more acceptance in Australia. Australia is indeed more LGBTQ plus inclusive, while new challenges just emerged, such as racial prejudice and cultural disconnect. For many, their sexual identity became more visible and accepted in Australia, but their ethnic and migrant identity became more salient and sometimes stigmatized. So the Chinese migrant identity is more important to them in Australia. These factors impact social support they need. First, psychological counseling is critical, but it must be like culturally sensitive and accessible. Second, people we interviewed just said they want support from their Chinese peers, like support related to their Chinese migrant identity. Because of the pressure to conform to traditional family expectations was persistent for gay and bisexual men, so they also need supports related to it. Final takeaway, so to support Chinese LGBT migrants, well, we need to focus less on coming out and just more on helping them settling. Thank you.
Thank you, Ting. That was really wonderful just to hear. I guess from that perspective, it's really helpful to hear that. So now we have Sekna Beckett and Bernard Saliba. They'll be co-jointly presenting on Inviting In, a community-led mental health framework for LGBTQ plus people from culturally diverse backgrounds. Sekna is a senior registered psychologist with over 25 years of clinical experience. She not only practices but also teaches at universities nationally and internationally. Sekna is passionately dedicated to her work with people navigating diverse aspects of their identities, including bodies, cultures, religions, genders, sexes, and sexualities. Bernard is an Arab Australian academic and is a senior lecturer in public health at UTS and a PhD candidate at the Kirby Institute at UNSW. Bernard's research and teaching focuses on the intersections of culture, sexuality, health, and belonging. His work explores the health and well-being of marginalized communities, particularly queer people from culturally diverse backgrounds. So they will be introducing Inviting In, a mental health resource and framework co-developed with LGBTQ plus individuals from culturally and racially minoritized communities. Moving beyond the dominant coming out narrative, the framework centers safety, agency, and cultural belonging, particularly for those navigating intergenerational family ties, faith, and collectivistic values. So I'll let them share their project now. Thank you.
Please note the following slides have no audio or sound.
I guess we'll start with acknowledgements. I am Deb, and my pronouns are she, her, and I'll leave Lisa to share her pronouns. Just acknowledging we're meeting today on Aboriginal land. We're both meeting on different lands. Just shows you the power of technology. I'm coming to you today from Darkinjung land, and Lisa is meeting with us on.
I'm coming from the lands of the Widjabul Waible people in the Bundjalung Nation, which is up in the north of what's now known as New South Wales. So I also would like to pay my respects to the elders past and present of these lands and of all of the lands that we're meeting from today, and also to emerging leaders. This always was and always will be Aboriginal land. Thanks, Deb.
And we'd also like to acknowledge that the importance of lived and living experience, particularly in the work that we do in mental health. The voices are very powerful and your contribution's vital to enabling decision making for health system change. And I guess in ACI, it's one of the critical focus areas that we have, isn't it, Lisa?
Yeah, very much so. And I think through this presentation, we'll talk a lot about the co-design. And just before we move on, I do have to acknowledge to the previous presenters that I feel quite moved because the inviting in concept is very dear to my heart. I didn't know where it came from. It was suggested to my partner and it made such a difference. She came out quite late in life and it made such a difference to her experience. So, yep, heartfelt. Thank you.
Yes, thank you. I'd just like to acknowledge the previous presentations as well. I feel very humbled and to be presenting this work amongst all your amazing work. Just to give you some background and context, and I'll just do the sort of the beginning and just total credit to Lisa and an amazing project person that worked with Lisa, AJ Jensen, who actually are responsible for this amazing piece of work. I feel a little bit, and I always say, Lisa, you've got to come, because I always feel like, I'm sharing their work. I was responsible for getting the money, I could say that, but then I went on to comment. So in August in 2023, we actually there was an expression of interest through the New South Wales LGBTIQ plus health strategy implementation plan. There was a funding pool to implement, the strategy. So and it was actually Lisa and I again that put this project proposal together to look at specifically working and developing a resource for New South Wales child and adolescent mental health staff. So that there could, just in total recognition, that's my background as well. I come from, perinatal child youth mental health, sort of clinical background and manager. And, just the amount of young people who come through our services who are, needing sort of this type of support. And I don't know that we're always that well prepared as clinicians to support people adequately. Next, so we were fortunate to actually get that funding. We were one of 21, Lisa. So I was trying to find out. I think we were one of 21 projects that were funded across New South Wales for that sort of that period of time. And it was, I think there were 4 or 5 that were actually mental health projects. So pretty good representation when that funding pool was announced. So over to Lisa, who's going to show us the video.
Thank you. Yes, that's the afternoon for videos. As far as I'm aware, this was the only project. There may have been one other that specifically addressed the needs of young people. So we will start with the video, and this is I will drop the link to the resource in at the end of the presentation, and you'll see behind Deb and I, there's a QR code. That's the other way of accessing the resource. So I'm hoping that,
how's it going?
Yeah, can you hear that? I'll turn it up.
I'm good.
Ready to get started?
Very ready.
Here we go. Yeah. Started?
Yeah, let's go. Welcome to the Rainbow Resource for Mental Health Care, your guide to providing inclusive and affirming care for LGBTQIA+ young people.
This resource was developed with LGBTIQ+ young people, their families, and experienced mental health professionals.
These videos will help you navigate conversations about identity
and create really safe and supportive spaces for young people.
We'll cover topics like the lived experience of LGBTIQ young people,
how to work in a safe and affirming way with young people and their families and carers, and what you can do to be an ally as a mental health clinician.
You will hear from gender diverse people from all sorts of backgrounds and lifestyles.
We know that providing safe, affirming and inclusive care for young people is so important because it acknowledges the experiences and identities every young person brings, and it also meaningfully involves young people in their care and the decisions made.
Thank you so much for your commitment to learning and exploring this resource.
The only way we can change this is if we all put our mind to the same goal
And help support young people and their families.
So as part of the production of the resource, a number of videos were made. That's sort of the promo video, and you'll see throughout the website, I think there's 3 or 4 other videos looking at particular areas. So I'm just having trouble moving to the next slide. Oops. Love technology when it works, and I find it challenging when it doesn't. Okay, so as we mentioned earlier, this was a co-designed piece of work. So, and also as we mentioned earlier, we know that LGBTIQ plus young people are ridiculously overrepresented in the mental health system in New South Wales Health. We still don't have any statistics that are New South Wales specific, but there's a whole heap of other statistics. For example, the Writing Themselves In report that comes out of La Trobe Uni that evidences the experience of young people beyond experiential evidence. So the group that developed this video was a group of 16. There was 8 young people from across New South Wales. The youngest person was 13 and the oldest one was in their 20s. They'd all been users of the Child and Adolescent Mental Health, New South Wales Child and Adolescent Mental Health Services. And then we had 8 clinicians, including somebody from 2010. I really loved how Bernard, I think you talked about it as being really culturally important to our communities, and it is exceptionally culturally important. I agree, to our community. So we had this really vibrant group that met sometimes weekly, sometimes fortnightly for a number of months to develop the resource. We took a big mind to making it safe for the young people to participate. So there was pre-briefing meetings and debriefing meetings, and we put in checks like making sure that there was no crossover between the clinicians and the young people who were in the group, that people hadn't been the direct providers of service to take that dynamic away. Some of the things that we learned through the process was that community networks were essential to the success of the project. So internal to ACI, our first battle actually was getting our organisation to understand why the project had to be led by somebody from the LGBTIQ plus communities. And so we had to do our own internal awareness raising about importance for this work to be led by and from our communities. We're incredibly lucky to get AJ, who has a strong faith background and has a really strong background of understandings of and practices of intersectionality. So that's really what that second dot point's about, is saying that in a more bureaucratic way. So I think the other thing that we learn out of this is, and I've heard it referred to since, is I don't know that this is the right way to say the right way to pronounce it, but like the fragilitizing of people with lived experience. So there was a fear that young people who may still be clients of CAMS or mental health services, that it would be dangerous or risky for them to be involved in a project such as this. But doing this project, what we helped demonstrate was that regardless of your mental health, experiences like this can be uplifting, that advocating for your human rights and others' human rights can actually be part of healing, can be experienced as part of healing. So the resource was launched by the Secretary of Health. We did that because we wanted to get it on the agenda of the LHDs throughout New South Wales. The resource is targeted directly towards clinicians. However, we know anybody can land on the page, and we've tried to put in enough resources there so that regardless of who you are, when you land on the page, you'll be able to navigate your way as a young person out to places like 2010, as a person of faith to a number of support organisations or support groups that exist, and as a parent to be able to get the support that you need. What I found for the clinicians when I was working as a clinician myself in mental health services in the CAM space was that they want to do the right thing. Allies want to do the right thing, but they're fearful. They're fearful of saying the wrong thing, of setting young people up for failure. So this is really this is a gift. We've tried to give this as a gift to them, so that they can improve the work that they do with young people, and it really is based in the concept of affirming care. So providing sexuality and gender affirming care for young people. And you'll see in the bigger picture there there's a couple of the younger people from the working groups and parents who are also involved. We worked closely with Intersex Human Rights Australia as well. One of their members is there, and so on. And so I thought I would take you to the Rainbow resource, and I think I'll just go and grab it off my other screen and bring it over. I also realise that I've run out of time, so maybe I won't. We've gone 10 minutes, haven't we, Deb?
You can go for another 2 minutes. That's
another
great.
2
Yeah,
minutes.
yeah.
I think it's helpful to show.
It'll be good to
so
show
fantastic.
it. Yeah.
Show it. Okay. Let me bring it over then to you from the other screen. Again, I love technology, but it's always such a challenge.
You're doing incredibly well.
Oh, thank you, Deb. Okay, there we go. One of my young millennial colleagues, I call myself the boomer, one of my fabulous young millennial colleagues has shown me how to share the screen instead of the window, so that you actually get to see what it is that I'm hoping you're going to see, rather than everything else that is on my screen. So this is the landing page, the video that you saw, the sort of little promo. So you'll see there that there's 6 tiles that you can go into, and each one of those has a number of pages underneath it. You'll see on the left-hand side in the second row down the toolkit of how to support young people. We talk a lot there about the affirming practice, and we've put it in the context of the CAM's best practice capabilities in the hope that the clinicians would be able to understand how they can take those standards and turn them into gender and sexuality affirming care. You'll see that there's a part, as I said, AJ is such a strong advocate of intersectionality. So we made sure that the group was really, as small as it was really as representative as we could make it, and that there is a section on cultural and linguistically diverse, the needs of the culturally and linguistically diverse communities, which also will take you to a number of resources. As I said earlier, that there's videos under each one of those. There's another 3 or 4 videos. I don't really know where I should take you because there's so much there. I really recommend that you have a jump on and have a look around. Deb and I are really open to answering questions via email if you want to drop us a line, if you'd like more information. And I think that I will end it there. Thank you.
Thanks so
Thank you,
much, Lisa.
Thank you, Lisa, and thank you, Deb. Thank you for sharing the page, because I was going to say the reason why I kind of reached out to ACOI because I saw the page and I saw that there was a culturally linguistically diverse section. So thank you. And look, and I guess it's really ties into Bernard and Sekna's work in terms of that co-design and how important that is. So thank you. And then tying it back to Ting in terms of sharing stories and videos as well. I realized that that was the thing of today. Sorry, Ting, you didn't get the memo to share a video as well. But look, thank you everyone for presenting today. And before we get into the Q&A, I wanted to just promote very quickly the Transcultural Mental Health Centre's Community Mental Health Profile webpage, which is hopefully coming up on the screen soon. Yep, there we go. So it's specifically on the LGBTIQ plus people from CALD communities. It's a summary of key resources and organisations. It's not exhaustive, but it's a good starting point. And if you are interested in learning more about even just Transcultural Mental Health Centres, other programs and services and the work we do, feel free to get in touch and let us know, even via the evaluation, which will come up maybe in a moment after we've done questions, to let us know if you wanted anything else that you're interested in or any other questions that you might have. So we will also then share what we've learned or the resources shared today on that webpage as well, if it isn't already there. So with the last kind of 8 minutes, we have some questions from registrations, and I'm going to invite our speakers to respond. And I just wanted to start with the first question. Feel free to speak up whenever if you feel you've got that answer amongst our presenters. So what do we see as the most effective strategies for culturally and linguistically diverse parents to engage in meaningful discussions with and providing support to their LGBTIQ plus children?
I'll jump in then.
Yeah, sure. Thank you.
I think that for parents, having a space for themselves to explore what's going on for them, to find their own individual support to help them unpack all of the feelings that they might have, to get to get what they want to say in order, and then to be able to respond back to the young person, offering them as much support as they can is the way to go. I think that obviously there's always the immediate response of trying to be very positive around what you're being told. I don't know how realistic that is, but I think, probably my takeaway would be for parents and families to get their own support so that they are able to engage in a way in which is positive for everybody.
Thanks, Lisa. I think I saw Sekna come off mute at one point.
Yeah, I did. Thanks for that, Lisa. And it's so important that parents do have that space. I find the most honouring way of working is through narrative practices in which the person, the culture, the religion is not the problem is the problem. And I'm collaborating with families to understand how, if it's possibly fear or grief, how that's named and honoured and heard. I think when people are truly heard, it can be quite transformative. And so that is honoured with families. I don't know whether Bernard would like to share, because I work with his family, some maybe evidence or practice-based evidence of some of the way narrative conversations worked with your family, Bernard?
I think, thank you, Sekna, and thank you, Lisa and Deborah, for that wonderful presentation as well. I think the first thing parents need to do is want to get support, because I think if they don't want to learn and they don't want to get support, then there's that's a barrier. What has worked with my family, I think, was this understanding that I was trying to change them just as much as they were trying to change me. And once there was an understanding that we're both approaching the same situation from a different angle, there was a kind of an acceptance of the other, a very slow process of accepting the other. I eventually accepted that they may never embrace me in the way that parents in Hollywood films embrace their queer children, and that's okay, because they will provide me with endless barbecues on Sunday and love in different ways that fills my cup regardless. So I think once I understood that, I think they as well have, in their own ways, over time accepted bits of me that for me are enough. So I think it's a two-way thing. I think this idea that parents have to accept, I also think that children have to accept their parents sometimes as well, as in some situations, of course, within limits. So it's in terms of, I don't think it's an easy answer to say what is the most effective way, but there are several ways, and it really is contextual and depending on the family and the factors that are leading the people to believe in the beliefs that they have. But I think that it's through this work that we're all doing as well, through visibility and through slowly chipping away at Chinese community migrants, at Arab community migrants, at Sydney, at Nepean, at regional. So it's a slow process to change society. That's essentially what we're trying to do, which is not an easy task.
Thank you, Bernard. I don't know that I can add to any of that. I think everyone's shared really good thoughts on that question. So another one, I guess, on the other side of things is how can health professionals manage their own biases and have those supportive and respectful conversations with LGBTIQ plus people from CALD backgrounds when providing mental health care?
I can speak as sorry, Sekna, did you want to? No, I can speak as a recipient of healthcare services. Sometimes acknowledging that the healthcare provider doesn't know is more effective than them trying to support when they don't actually understand the cultural experience and religious experience. And so acknowledging limitation in your own skills is a really powerful and not very practiced thing, I've noticed. So that would be one. And two, for me, would be to really show up to these kinds of talks and to really learn from us and our stories, and listen and recognize that difference exists. And I think and I teach this to my students, through listening to stories, you'd naturally develop more empathy for others. And so when you have more empathy for others, you can then it's so much better to say, I've heard of your stories. I don't know how to help you, but I've been to a couple of talks now to know a little bit about who can help or which resources to send you. Here's a couple of links. Here are some people to talk to, and then follow up. And I think that would be the way to support if you don't know.
I love that. That kind of goes back to what Sekna was talking about in terms of humility, or the cultural humility in the video. Did anyone want to add to what Bernard said?
I think it's important as practitioners that we're constantly examining our own assumptions, and humility is part of that. Even if I'm from someone's cultural, religious community, we're not a homogenous group. So it's so important to check our own assumptions and invite some kind of reflection on how do we continuously learn, how do we adapt our care so it's inclusive of the diverse needs of the people that we're meeting. But that's a constant work in progress, I think.
Thank you, Sekna. It's now 1:30, and so the Q&A hasn't gone as long as I'd hoped. So Look, thank you all for coming today, and to our speakers for being part of the Transcultural Mental Health Centre's TransFORUM. As mentioned, for all the resources we've shared today, we will put this on the TMHC Community Mental Health profile webpage. And so for any of those questions that have come through the registration, we will take these on notice and share information and links via that webpage. So feel free to get in touch if you have any questions that come up following today's webinar. So before we close the session today, in the New South Wales Health LGBTIQ Plus and Health Strategy 2022 to 2027, there was presented stories throughout the document, and I wanted to highlight one as the final words for today. Work was funded by the Western Sydney PHN, Went West, and undertaken by the New South Wales Service for the Treatment and Rehabilitation of Torture and Trauma Survivors, most would know them as STARTs, to improve the health and well-being of LGBTIQA plus people, delivering peer-led support groups as one part of their work. These groups provided an opportunity to discuss issues such as mental and emotional well-being, including loneliness and stress, and practical issues as well. And a link to this work is on our webpage as well. So these words are anonymous, coming from a support group participant. What makes us strong as LGBTIQA plus people seeking asylum in Australia is joining hands with each other. By reaching out to each other, we build up our community. Together we walk on, walk strong. Thank you, everyone, and have a wonderful day.
Thank you.
That concludes the session for today. Thank you for joining us. For more information about work in this space, or to access resources or links, please visit our website www.dhi.health.nsw.gov.au/TMHC.